Oftentimes, we see surrogacy broken into two categories. We have a medical need or we have social surrogacy. And really, the distinction between these two has a lot to do with the legal parentage process. So, certain states have certain requirements depending on where your gestational carrier or surrogate will deliver. But what we also oftentimes see here at Conceivabilities is intended parents who come in with this preconceived notion that they can only pursue surrogacy if they have a medical need. And that's just simply not the case here at Conceivabilities. We are proud and honored to work with intended parents of all kinds in growing their families through surrogacy for any reason, whether that be a medical need or social surrogacy. What is the difference between a medical need and a social surrogacy? And really, the easiest answer is that anything that's not a medical need falls under a social surrogacy. But when we're thinking of what is a medical need, now there's clear medical needs. So things like a same-sex male couple, an intended mother who does not have a uterus, whether that she's born without one or she's had hysterectomy, or an intended parent with any form of significant medical issue that could potentially cause a life-threatening issue during a pregnancy. Multitude of fertility diagnoses, other just medical diagnoses that would impact a pregnancy or a fetus's health, certain medications, cancer history, and we've even seen some mental health diagnoses rise to that threshold of a medical need requirement. The bottom line when it comes to what is a medical need is that we're looking for a medical professional. So whether that's a reproductive endocrinologist or some other form of medical specialist to make a medical opinion and determination that there is a sufficient medical need to pursue surrogacy. So if you don't fall squarely within that medical need definition, everything else is going to be that social surrogacy. Now, social surrogacy gets a bad reputation. It's often portrayed in society as the idea that an intended mother doesn't want to be pregnant, whether that be vanity reasons, whether that be wanting to shift the risk to somebody else. But in practice, we rarely see that being the reason or the case. The vast majority of cases that fall under social surrogacy have a reasonable and valid need for surrogacy based on some professional or other meaningful life circumstance. So some examples of what would fall on this similar social surrogacy continuum or spectrum would be, for instance, a ballerina. She has a very limited window of professional ability to pursue her profession. And if she were to take the time off from her profession to try to conceive, gestate a pregnancy, and then recover from that pregnancy, she would lose her professional standing and it would be a significant risk to her. So this is one of those kind of reasonable necessities we see from a professional setting where someone may choose to pursue surrogacy that doesn't fall within a medical necessity framework. Other examples could be a woman who has a familial history of breast cancer. She herself does not have the diagnosis, but she is concerned about pregnancy and all the hormone-related impacts of pregnancy and how that may impact any future health for her. And so she turns to social surrogacy, although there is that medical aspect to it. Another example would be intended parents who have had a long fertility road. They've tried to conceive both in a conventional method as well as potentially turning to some form of IVF. They have unexplained infertility. Now, this would seem like it should be a medical need, and it may for some doctors, depending on the specific facts. It may not rise to that specific threshold that they're looking for. So again, there may be a medical aspect to it, but it doesn't fit neatly within that documented medical need box. And so it would fall under social surrogacy. Social surrogacy just is very misunderstood and mischaracterized. We at Conceivabilities are most concerned about is the why. Whatever the why might be, is understanding that why and then disclosing that to a potential surrogate. So she can decide for herself if she's comfortable carrying a child for those specific intended parents with their specific why. But ultimately at Conceivabilities, again, we are just proud and honored to assist intended parents of all kinds in growing their family through surrogacy, whatever their reason for doing so.